Hello and welcome. In this video we're going to look at the shoulder. So first of all we call the whole structure the shoulder complex. It's then subdivided down into two sections. So you have the shoulder girdle, which is this part here, and then you have the glenohumeral joint, which are these here. Quite often people will call the glenohumeral joint the shoulder, so if people come to visit you and say they've got problems with their shoulder, it's more likely they're talking about this part here. So do bear that in mind, that most people wouldn't consider calling this the glenohumeral joint. So let's just go through the bones associated with the shoulder complex. So as part of the shoulder girdle itself, you have the sternum down the front here, the clavicles across the top, and on the back here you have the scapula. So those three bones make up your shoulder girdle. The glenohumeral joint is made up from the humerus and then the scapula. So that's the bones associated with the shoulder complex. Now we can have a look at bony landmarks. So you've got your sternum, which has your manubrium at the top there and your xiphoid process at the bottom. Your clavicles, you have your sternal end and your acromion end. On the scapula, a lot more landmarks here. So you've got the inferior angle of scapula and the superior angle of scapula, the medial border and the lateral border of scapula. You then have the spine of scapula, which goes up into the acromion process, which is this bit that flattens out here. You have your coracoid process, and then you have your glenoid cavity, which creates part of your joint here. So that's the bony landmarks for the scapula. Then here on the humerus, we're just going to deal with the shoulder end. We'll do the elbow end when we get to the elbow. So nice and easy, head of humerus there. You then have your lesser tubercle and your greater tubercle, and that creates the bicipital groove here where the biceps tendon runs up. And then if you follow down from the greater tubercle here, you have your deltoid tuberosity, which is a little point here on the humerus, and that's the insertion for your deltoids. Your deltoids cap over the shoulder and then come down to here, so they actually come quite a way down the arm if you look at them. So that's your bony landmarks for the shoulder complex. Now let's look at the joints associated with the shoulder complex. So first of all, within the shoulder girdle you have two. So you have your sternoclavicular joint at this end, and you have your acromioclavicular joint at this end. These are both synovial sliding joints, so they're going to allow you to do things like shrug your shoulders, or if you want to take your arm past 90, these structures need to move and these joints allow it so that you can bring your arm up higher. So that's the ones for the girdle. So the other one is your glenohumeral joint. So this is the one most people come to see you about, or feel that they come to see you about sometimes. So this is a ball and socket joint. It's a synovial joint, so it's a very unstable joint. So it has masses of range of movement, but because of that you do compromise your stability of the joint. So there's lots of structures, lots of muscles and ligaments around there, plus the capsule that will help to stabilise that. So you've got your synovial capsule, which comes from the cavity across and over down past the head of the humerus. You also have in here something called the labrum. So within the glenoid cavity you have the labrum here, and that just helps to deepen that joint socket to give it a bit like you have in your hip, so that will help you to have a bit more of a stable joint. And then obviously, like I said, there's the ligaments and bits and pieces around it to help stabilise it. So that's your joints associated with the shoulder complex. We've covered bones, bony landmarks, joints, so let's move on to ligaments. As you can imagine, there is a mass of ligaments through here, but we're only going to look at a few. So first of all, starting with the glenohumeral joint, you have the glenohumeral ligament, and it's actually a thickening of the capsule that goes around here, and it's an anterior ligament, so it goes from the cavity up here onto the lesser tubercle, so it's kind of this direction. So that's an anterior ligament, and that's the glenohumeral ligament. So then around the acromioclavicular joint you have 3 ligaments, or 3 that we're going to look at. So they all tell you where they go, so that's fantastic. You have the acromioclavicular across the top, you have your coracoid clavicular and your coracoid acromial. So you've got 2 that come up like that in a bit of a V, and then 1 across the top to try and help stabilise that little joint. Then at the other end, at the sternal end, you have your interclavicle ligament, or interclavicular ligament, which goes across here from one clavicle to the next. You have your sternoclavicular ligaments, which sternum to clavicle, and then you have your costoclavicular ligament, which are little ligaments in here which go from the costal cartilage here onto the clavicle here. So that's the ligaments for the sternoclavicular joint. So that's all the ligaments you need to know for your active IQ level 4 qualification. Moving on to bursas. As you can imagine, there is lots of bursas within the complex, but we're just interested in 4, so it's nice and simple. So you have your subacromial, which sits here, tells you exactly where it is. Your subdeltoid, which sits here, so it runs underneath the deltoid, sits underneath the deltoid, where it comes over the greater tubercle here. So it just protects the deltoid from this very prominent bony landmark. You have your subcoracoid, which sits here, and below that again your subscapular bursa. So that's all the bursas you need to know for the shoulder complex. Finally, muscles. So before I run through the list, there's just one group of muscles I'd like to talk about separately first of all. So you've probably heard of them, they're the rotator cuff muscles. Often people come to you and say, oh, I've injured my rotator cuff muscle. People assume it's one muscle, but it's not. It's actually 4 independent muscles. So it can be a little bit difficult to try and, especially if they've seen someone else and said, oh, they've injured their rotator cuff muscle. It's very hard to figure out sort of which muscle it might have been if it's an old injury. So just to take you through them, you have supraspinatus, which runs across the top here, over the top of the spine of the scapula, which goes into there. You have your infraspinatus, which sits here. You then have your subscapularis, so it's on the anterior surface of the scapula. And finally you have teres minor, which comes off the side here. And all 4 heads come up onto the head of the humerus. And it's often remembered as TISS, so teres minor, infraspinatus, supraspinatus, subscapularis, just to help you remember the order of them across the top there. So that's the rotator cuff muscle, and its function is predominantly to stabilise the glenohumeral joint. And what it does is it pulls the head of the humerus up into the glenoid cavity, and to help balance that out you have the deltoid, which pulls it back down. So one muscle is pulling it into the cavity and then the other one is pulling it down. So if you lose balance between, say, the deltoids and the rotator cuff muscle, you're going to start to possibly get joint problems for lack of space or too much space and not enough stability. So it's really quite important that there's a good balance around these muscles. So other muscles that you need to think about for shoulder problems, and one that actually gets neglected a lot when people have shoulder problems, is pectoralis major. So it's a big muscle in the front and people completely forget about it. They tend to treat the shoulder from the back, and it's not always the cause. You really need to consider this muscle here. So you've got pectoralis major, you've got pectoralis minor underneath it, which is a very deep muscle, incredibly difficult to access properly. Obviously you've got your 4 rotator cuffs, which we've been through, and your deltoid. Others as well is levator scapulae, which comes across here onto the scapula, so it lifts, it's part of that shrugging movement. The trapezius muscle, so that comes sort of from here out to there and comes down to your 12th vertebrae and back up the other side. So that's a huge flat muscle. Underneath that you've got your rhomboids major and rhomboids minor. Latissimus dorsi, so that starts all the way down here, and it's mostly, well, it's all fascial planes. It comes off the fascial plane And if you've seen bodybuilders, it kind of wings up like this. It wings up onto the humerus there. A couple more that get forgotten is biceps brachii. That does actually have an impact on the shoulder. Not a huge one, but again, if it's tight, it can be causing problems to the shoulder. And coracobrachialis as well there. And one more tiny one here to think about is the teres major. So you've got teres minor, which is part of your rotator cuff, and then teres major, which sits just below it here and comes up onto the humerus. So that's all the muscles associated with your shoulder, and that's everything you need to know for the shoulder complex. So you can now go on and complete your quiz, and once you've completed your quiz, you can move on to the next section.